Alcohol use disorder has created a uniquely vulnerable population worldwide. Alcoholism can affect a wide range of people and it does not discriminate based on race, age, or socioeconomic status. The WHO reports 3.3 million yearly deaths worldwide related to alcohol abuse. Alcohol is the leading risk factor for premature mortality and disability among those aged 15 to 49 years and also accounts for 10% of all deaths in this age group. Disadvantaged and especially vulnerable populations have higher rates of alcohol-related death and hospitalization. The statistics for alcohol use disorder in the United States are staggering. The NIH attributes 95,000 deaths per year to alcoholism and reports that in 2019, 14.5 million people in the United States experienced alcohol use disorder. Furthermore, more than 10% of children 17 years and younger in the United States live with a parent or caregiver who suffer from alcohol use disorder. Alcohol use among teens has also reached problematic levels, with the NIH reporting that 414,000 adolescents suffer from alcohol use disorder in 2019. Alcoholism is an issue that is not going away. The NIH reports that less than 10% of people with alcohol use disorder looked for treatment in the past year. Alcohol use disorder in the already vulnerable elderly population has quickly become a public health concern, and it will continue to worsen due to the large portion of the nation that will become elderly as the baby boomer generation ages. Bumesbach et al. Found the rates of alcohol use disorder are as high as 10 to 15% in all elderly primary care patients. Up to 30% of all older patients hospitalized in general medicine have alcohol use disorder. Even worse, the rate of alcohol-related hospitalizations in elderly individuals has been found to be similar to that for MI, with 38% of hospitalized having an alcohol-related diagnosis. Shield and REM found that there are at least 27 ICD-10 codes related to alcohol use disorder. Malignant neoplasm, cardiovascular disease, and diabetes have all been linked to alcohol use disorder. Women can experience a host of adverse effects related to alcohol abuse. The WHO found that in 2019, about 8% of women aged 18 to 25 years had alcohol use disorder. 13% of adult women reported binge drinking an average of 4 times per month. Hutton et al. Found that among women, binge drinking was uniquely associated with risky sexual behaviors and an STI diagnosis. Alcohol also increases the risk of sexual and domestic abuse for women. The NIH has found that 1 in 10 women reports alcohol use during pregnancy. Pregnancy is a woman's most vulnerable time, and any alcohol use can have severely detrimental effects on the woman and her baby. Adolescents are particularly susceptible to becoming alcohol abusers. Alcohol is the most widely used substance among America's youth, and drinking by young people poses enormous health and safety risks. The NIH states that underage drinking is a serious public health problem in the United States. People ages 12 to 20 drink 4% of all alcohol consumed, and although youth drink less often than adults, when they drink more. It is estimated that 90% of all alcoholic drinks consumed by young people are consumed through binge drinking. According to the CDC, in 2019, about 32% of female high school students consumed alcohol, compared with 26% of male high school students. Alcohol use can also increase the likelihood of risky sexual behaviors among teenagers. According to Dehan, Marshall, and Strang, evidence suggests that primary care intervention is an effective and acceptable method of detection and treatment of alcohol abusers. Nearing, Freeman, and Dorr point out that all healthcare workers have a responsibility to watch out for alcoholics and make appropriate referrals. The prognosis for most alcoholics is guarded. Less than 20 to 30% discontinue drinking, but early interventions are key to improving outcomes. Weiss and Guzmano state that unhealthy alcohol consumption is an important problem and that addressing it can support a broader policy agenda of reducing health disparities. The key is to educate the patient and the family about the destruction that alcohol can cause. Nurses in particular are well placed to improve the health outcomes related to alcohol abuse. Through the tailoring of nursing care and nursing diagnoses, issues around alcoholism can be addressed, and nurses can help to bridge the gap in care which this vulnerable population is currently experiencing.